Hello. Today we will have a dissection of the brachial plexus. Now, brachial plexus is nothing but that's a group of network of nerves which supply to entire upper limb. And these brachial plexus are formed from the ventral rameys of C5, C6, C7, C8 and T1 segment of spinal cords. And these brachial plexus, it consists of roots, trunks, divisions, cords and the branches. The roots are, like as I mentioned you, the roots are derived from C5, C6, C7, C8 and T1 segments of spinal cord, and each root will join to form the trunks. Now, the roots of C5 and C6 will unite to form the upper trunk, C7 will continue as the middle trunk, C8 and T1 will unite to form the lower trunk. After forming the trunks, each trunk will divide into two divisions, upper trunk into anterior posterior, middle into anterior posterior, lower trunk into anterior posterior. Now, coming to the cords, the anterior branch of upper trunk and the anterior division of the middle trunk will unite to form the lateral cord, whereas the posterior divisions of upper trunk, posterior division of middle and the lower trunks will unite to form the posterior cord, and the anterior division of the lower trunk will continue as the medial cord. So, we have lateral cord, medial cord and the posterior cords, and each cord will have some branches. So, lateral cord will give of lateral pectoral nerve, it gives of musculocutaneous nerve, lateral root of median nerve. Medial cord will give of the branches like medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm and the ulnar nerve. The same way the posterior cord, it gives of again the branches like upper subscapular nerve, thoracodorsal nerve, or it is also called as nerve to latissimus dorsi, axillary nerve, okay. It also gives of the radial nerve and also the lower subscapular nerve. So, these are all the branches arising from the cords of brachial plexus. So, I will demonstrate all these branches of brachial plexus arising from the cords on the cadaver. Okay. Now, coming on to the cadaveric demonstration of the brachial plexus. Now, here I have painted the brachial plexus in yellow color, and this red color structure is axillary artery. Now, already in the previous video I have made a clear description of the axillary artery. Now, this is the lateral cord. Okay. So, this is the lateral cord. This lateral cord of the brachial plexus, it is giving off three branches. One branch is supplying to the pectoralis major muscle, which is the lateral pectoral nerve that I have already cut, which carries the fibers of C5 and C6. And this nerve, this is the musculocutaneous nerve. This musculocutaneous nerve, it carries the fibers of C5, C6 and C7. And this musculocutaneous nerve, it pierces the coracobrachialis muscle, supplies to that muscle, and it is a nerve of anterior compartment of the arm. Now, next branch of lateral cord of brachial plexus is this one. This is the lateral root of median nerve, lateral root of median nerve, which carries the fibers of C5, C6 and C7, and this is the medial root of median nerve. Yes, this is the, I will make it clear, this is the lateral root of median nerve, this is the medial root of median nerve. Both these roots are joined to form this nerve, this is the median nerve. Okay. So, this is lateral root of median nerve. So, that is all about the lateral cord. Coming to the medial cord, medial pectoral nerve already I have been shown in the other video, where it pierces the pectoralis minor muscle and supplies to the major, that I have already shown you. And the next branch is this one, is medial root of median nerve. Okay. And this one is the medial cutaneous nerve of forearm, and this one which I have cut, this is medial cutaneous nerve of arm, and this nerve, this is the ulnar nerve. Okay. So, we have the medial cord branches, medial pectoral nerve, which I have demonstrated in the last video. This is the medial root of median nerve, this is medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and this is the ulnar nerve. Okay. Yeah, as I mentioned you, again I am telling you, this lateral root of median nerve, medial root of median nerve. Together they form this nerve, which is the median nerve. Okay, medial root of median nerve will carry the fibers of C8 and T1, and this median nerve is a nerve of front of the forearm or the flexor compartment of the forearm. That's all about the branches of medial cord. Then coming to the posterior cord. The posterior cord of brachial plexus, it gives of the branches like, this is this branch, this one. This is the upper subscapular nerve. This is the thoracodorsal nerve which supplies to the latissimus dorsi. This upper subscapular nerve, it carries the fibers of C5 and C6. This is upper subscapular nerve. This is the thoracodorsal nerve which carries the fibers of C6, C7 and C8. This one. This is the lower subscapular nerve which carries the fibers of C5 and C6. Next you have this nerve, which is very thick nerve. This is the radial nerve. Radial nerve will carry the fibers of C5, C6, C7, C8 and T1. And just lateral to this radial nerve, you can see this nerve. Yeah, this one. This one. This is the axillary nerve. This axillary nerve, it carries the fibers of C5 and C6. Okay. So this is axillary nerve. So I repeat the branches of posterior cord of brachial plexus. This is again, this is upper subscapular nerve. This is the thoracodorsal nerve. This is the lower subscapular nerve. This is the radial nerve, and this is the axillary nerve. So these are all the branches of posterior cord of brachial plexus. Apart from the cords, you also see the branches from the roots of brachial plexus. Here I can make out this nerve, which is a long thoracic nerve. This is the nerve to serratus anterior, which carries the fibers of C5, C6, and apart from this, you also have the dorsal scapular nerve from the C5, which arises from the roots, and from the trunks we have two branch, suprascapular nerve and the nerve to subclavius. So these are all the branches of the brachial plexus. Thank you.